Welcome back, everyone. I'm so glad that you tuned back in tonight. Now, last night's episode, we learned about a lot of toxicities that might be compromising your body, making you sick. A lot of trash that might be building up in your body. You know, the vaccines, the GMOs, the fluoride, the aspartame, and so forth. We learned about all that. Now, let me ask you a question. If your toilet was overflowing in your house, what would you do? Well, you know what to do, don't you, right? You call the Roto-Rooter guy and he comes out and he unclogs your pipes. But how many of you actually know how to get those toxins out of your body that have accumulated over the years? How many of you know how to properly detox your organs so that you can get that trash out of your system and so that you can be healthy like you were intended to be? Many of you may not. So that's why I'm glad that you tuned in tonight. This first interview with Dr. Patrick Quillen is going to be some really amazing information from you. I'm so excited to be able to talk to him because he uses the analogy that detoxification is like growing a garden. How so, you might ask? Well, he says that in order to grow a garden properly, you've got to detoxify the soil. You've got to get rid of the sticks, you've got to get rid of the stones, and you've got to make that soil fertile so that the plants can grow the way that they were intended to. You've got to do the same thing with your body. And that's what Dr. Patrick Quillen shares here with us. He says you've got to detoxify your body so that you can grow and be healthy the way you're intended to. And we're going to learn specifics in this episode about how to do that. So pull up a chair, stay tuned. You're going to really enjoy this information, first of all, with Dr. Patrick Quillen. I've heard you say that health is like growing a garden. Why do you compare those two?
Well, if you think about, not everybody in America has access to a garden, but I hope you at least have some appreciation that I don't care if you live in Central Park or near Central Park in New York City, and I've been to New York, a dozen times, and it's a beautiful, vibrant city, but go to the nearest botanical gardens and have a look at nature and have an appreciation for it. Because when you find a patch of land and you say, I want to grow a garden here, the first thing you're going to do is take out the weeds and sticks and stones and detoxify that patch of land. The same thing with the human body. You find a body that's not well, all kinds of symptoms. We mentioned some of the common killers in America. And from those symptoms, first thing we would do is say, we're going to take you just like that piece of land. Let's detoxify you first. Let's take out the heavy metals, the volatile organic chemicals. Studies have been done looking at Americans where these are legitimate labs, FDA-approved labs that have looked at urinary output from volatile organic chemicals. BPA, bisphenol A, is one that's commonly found in almost all of us. Flame retardants in almost all of us. You think, well, how did it get there? The fact is that many of us have been exposed to frightening levels of chemicals that in many cases are hormone disruptors. That is, they affect the ability of the body to make male or female hormones, insulin. The many hormones are now dysregulated. So those chemicals, the heavy metals, the toxic burden in the gut, many of us are causing what's called autotoxemia. Auto is in self, toxins in the gut. And now you have yeast, Candida albicans, bacteria, yeast, virus, other organisms that can move into the bloodstream and generate autoimmune diseases, even cancer. There's a whole chapter in my book, Beating Cancer with Nutrition, that talks about, is cancer in some cases actually an infection? And that's a whole fascinating subject. Back to the business of what does a garden have to do with our body? Detoxify.
So what is detoxification? It's heavy metals, it's parasites, it's pesticides, it's all these kinds of toxins that are in your blood and in your body. But what does that have to do with the immune system? Now, if you remember in episode 2, we talked about the immune system and the toxicities. And in this next segment, Dr. Murray Susser elaborates on the effect of heavy metals in the immune system, specifically talks about what is chelation therapy.
The immune system plays a pivotal role in cancer. It may be the reason we get cancer. When the immune system fails for whatever reason, and what is the reason for failure? As you mentioned, toxicity. And what kind of toxicity do you have? Well, we all have too much toxic metals in our body. Okay. We all have too much lead, cadmium, mercury, and Walter Blumer. Have you heard of Walter Blumer? Yes. From Switzerland? He did a study where he gave. I forget the exact numbers. It's 50-some people got chelation every month. Chelation means metal binding. It's a process of putting a substance like EDTA in the body. It hooks onto the metal, floats it out the kidney, and that's a major detoxifier for heavy metals. Sweating is good too. In Finland they did a study with saunas and sweating, and they found you could sweat out more lead in an hour than you could pee out in 24 hours.
Wow.
So sweating is good, but it's still not enough, not enough in most cases to get rid of the lead toxicity. And Walter Bloomer said that there was a 90% decrease in cancer in patients who got the chelation.
Wow.
And 90% decrease. He had 59 patients who got treated. One of them got cancer over an 18-year period. Of 117 patients or so who were the controls in a sense. They didn't get the chemotherapy. They didn't get the chelation, and that group had 17 cancers. The study was not a perfect study, but it was a very good study, and it was approved by the Swiss government.
Okay. Let's talk about the heavy metal link and talk about chelation therapy on treating specifically cancer.
Well, chelation doesn't treat, you don't use chelation to treat cancer or autism. You treat chelation to remove heavy metals, and heavy metals cause oxidative stress, and it's the oxidative stress that is the commonality in all the toxicities that lead to disease. I actually often have said that I'm nothing more than a glorified trash man because I just can take out the trash better. That's really what it comes down to.
In allopathic medicine, Western medicine, what we accomplish in Western medicine is stabilization of the patient. Okay? Their blood pressure's high, we give them something to bring it down. The blood sugar's high, we give them something to bring it down. They're dehydrated, we hydrate them. Okay? We're not fixing any problems.
You're just alleviating the symptoms.
Alleviating a symptom is all we're doing, okay? But it stabilizes the patient, okay? That is the first step of healing. If you have a bleeding wound, first step in first aid is to stop the bleeding. You don't do anything with it till you stop the bleeding. That's the first rule in all first aid. There's a bleeding wound, put pressure on it, stop the bleeding.
Right.
Number one. Well, the next rule is all dirty cuts never heal. Okay, so if you have a dirty wound,
clean it.
You have to clean it. You have to detoxify it.
Okay.
Okay, this is your next step. Okay, detoxification in the healing process is the second step. Once you're stable, you must detoxify in order to progress. Otherwise, you're going to just spin your wheels, or spend a lot of money just trying to feel better. You know,
Right.
you'll take a supplement or take a medicine. You'll feel better for a little while. It'll work for a day, 2 days, a month, maybe, and then it doesn't do anything because you're still managing toxins in your body. Okay, you got to remove the toxins. If you're going to plant a garden, you know, there's garbage all over the ground. You don't just till the garbage into the ground. You go and clean it up. Then you plant your seeds and you till your garden, right? So similar thing. We have to clean
Get rid of the
trash.
trash.
We got to get rid of the trash. You got to get because all those toxins in your body are blocking the healing process.
Mm-hmm.
They're, you know, that might be amalgams in your teeth. It might be an infection. It might be, you know, a yeast overgrowth. It might be, you know, fluoride or, you know, environmental toxins and pesticides, herbicides, you know, heavy metals, all these different things. They have to be removed out of the way. Every one of those things is a roadblock to your healing.
Right. And you said earlier in the interview that if you are nutritionally deficient, you're a toxin sponge.
Right.
I heard you on a radio show recently. I think it was Robert Scott Bell show.
Sure.
But you were mentioning that the importance with detoxification is that, and I wrote down the quote, you may have to make sure that the exits are open and the filters filter quickly.
Filtering, right.
So talk about those,
okay,
those
so,
comments.
My favorite analogy of that is if you had a stadium, 10,000 people in it, okay, and there's a fire. You got to empty the stadium, but you only have 2 exits open. You're going to make a mess. You know, there's going to be a mess. That's the bottom line. This is not going to come out, it's not going to turn out well, you know. But you open 10 different exits, it's 5 times better. You'll open 20 different exits, it's going to be 10 times better.
Yeah.
Okay. In the body, we have 4 major exits. We have the bowels, we have the respiratory system, we have the urinary tract, and we have the skin. If those 4 are open and able to, things can exit through those routes, detoxification isn't so bad. It doesn't, it's not so painful. If you've got a cut that's scabbed over, but it's dirty, and so it's festering and infected, you're going to have to pull that scab off. You're going to have to get in there and wash the infection out. Okay?
And it ain't going to be pleasant.
That's not going to be pleasant, okay? If it didn't have the scab on there, the exit would be a lot easier.
Right.
Okay? And so there's, cleansing that has to happen to open up the pathways. Then, once you've opened up the exits, working on the filters, the liver, the kidneys, the lymphatic system, getting those things moving and metabolizing as fast as possible. That way they filter the toxins out of the body. In everything you do to detox is much easier then. That's where colon cleansing, saunas, colonic irrigations, those types of things that just flush the body, open the exits. Those are initially some of the best things to start with, because if you can start with working on the filters, the kidneys, the liver, the lymphatic system. If they don't have anywhere to dump the garbage, it's going to recirculate.
Okay.
And it just creates all kinds of inflammation. It increases your rate of oxidation.
Yeah.
You're just re-exposing yourself to toxins.
So according to Dr. Buttar, we've got to take out the trash, or in the words of Dr. Newsom, we've got to remove the roadblocks. But what about foods? Can foods help us to detoxify our bodies? Let's listen to Dr. Lee Aaron Keneally and Mike Adams, the health ranger, as they talk about the fact that foods can actually bind to heavy metals and help us to detoxify our bodies.
The process of their job, they're dealing with mercury. So mercury is everywhere. Arsenic, Discover magazine had the front cover, the metals in your food. The EPA says there's no safe level of any heavy metal and toxic heavy metal in your body. Okay, so when they put norms there, okay, first of all, how do I know what's normal for you? Okay, what may be normal for you may be terribly destructive to me.
Because we're individuals.
We're individuals, and so I might not be able to handle one little anything of mercury, and you might be able to, I can handle this, I can manage it. But the EPA says, the Environmental Protection Agency says, there's no safe level of these metals, arsenic, mercury, aluminum, in your body. And so, we have to eat foods that help us detoxify.
I've done extensive research on what's called the metals capturing capacity of different types of foods. I call it the MCC, where I test using a synthetic gastric acid digestion simulator that I built in the lab. I test foods versus contaminants, and I find out how much of the contaminant gets bound to the food and thereby carried out of your digestive tract as insoluble fiber rather than being absorbed through your intestinal walls and going into your blood.
Okay.
This is a key concept to understand to answer your question. Processed foods have very low capturing capacity because the fibers are typically processed out of them. They're also structurally compromised through processing. They're denatured.
Right.
In other words,
which makes them into unfood.
Unfood. So if you eat, let's say, a processed food meal or a beverage that is contaminated with, let's say, 10 parts per million of mercury, you are likely to absorb the vast majority of that mercury through your intestinal walls that goes into your blood. Or it could be radioactive cesium-137.
Okay.
Mercury, cesium, lead, cadmium, you
Whatever
name
it might be.
Right. But if you are eating a diet of unprocessed fresh foods,
Okay.
this is a whole plant-based diet.
Right.
Doesn't have to be 100% plants. What we have found is that natural plants, fresh produce, such as strawberries,
Okay.
have very high natural metals capturing capacity. They're able to bind with the metals, mostly through physical processes of absorption and adsorption as well. Some foods have selective ionic affinity to specific metals such as lead.
Okay. Which means
that they have a chemical reaction that binds up the metal.
them, right.
Yeah, it's chemistry taking place
Okay.
in the acidic environment of your stomach, typically, with your own gastric acid. So strawberries, for example, this is something that I researched. I'm still working on the scientific paper to put this out there. But strawberries will bind with over 90% of your dietary mercury. Strawberries. And the reason this is the case is because strawberries are the only common fruit that has seeds on the outside of the fruit.
Okay.
The seeds being on the outside, how are they grown? How are they produced by the strawberry? Well, there are strands, fibers, that send nutrients to the seeds from the center of the strawberry. The center is where it gets its nutrition. It distributes it through the fibers to the seeds.
Okay.
These fibers, which are transparent practically under a microscope, happen to be very, very tough fibers. They will not be digested by nitric acid in the laboratory.
Wow.
I can take strawberries, I can put them, mix nitric acid, we're talking like 70% nitric acid, very strong oxidizer that would burn the skin right off your hand.
Yeah.
It will not digest the fibers in the strawberry. The fibers survive human digestion, which is far weaker than nitric acid digestion.
Okay.
I mean,
Yeah.
orders of magnitude weaker.
Sure.
The strawberries then will bind to the dietary mercury with these fibers, and that gets pushed out of your system through bowel movements. The mercury is gone, it's out. Never gets pulled into your bloodstream through intestinal walls. So many different types of fruits and vegetables have very interesting affinities to heavy metals, and this is what our research has really uncovered. The only thing that we found better than strawberries, by the way, is chlorella, which is about 98 to 99% efficacy. But chlorella doesn't work for other things such as uranium. Chlorella doesn't absorb much uranium. Spirulina does, but not strawberries.
Okay.
So one of the things that I've done in the lab is, whether it's radioactive elements such as cesium-137 or customary heavy metals like mercury, arsenic, things that cause cancer. Arsenic is linked to cancer, right?
Yeah.
Oh, and by the way, you know what tends to absorb arsenic? Fruit seeds.
Fruit seeds.
Fruit seeds.
Okay.
Which is why some fruit seeds contain arsenic. Naturally.
Okay.
There's arsenic in apple juice. Remember that scare?
Yeah, I remember that.
Because the apples, when apple plants, apple trees, tend to take up arsenic in the soil, which came from the lead arsenate pesticides that we already talked about. They tend to concentrate it in the seeds because the seeds have a natural affinity to arsenic.
Okay.
But if you can get apple seeds, grape seeds, raspberry seeds, blueberry seeds, believe it or not, we've tested all these things. If you can get your hands on these seeds, which by the way are removed from almost all the foods that are sold in the grocery store.
Yeah.
If you buy grape jam, you don't want seeds in it. If you
Right.
buy blueberry jelly, you don't want blueberry seeds in it.
And that's where all the good stuff is.
It's the seeds that bind with the dietary arsenic
Wow.
and transport it out of your body. Yeah, I haven't released that information yet. You're the first person to have this conversation.
Now, Mike Adams, the health ranger, just shared with us about the MCC, the metals capturing capacity of certain foods. Now, what about coffee? I know certain people would swear that coffee is a food, and maybe it technically is. But are there any properties of coffee that could help us to detoxify our bodies? Let's listen to two prominent medical doctors chime in on this issue. Concerning coffee enemas, is that something you think would be appropriate for people that may not have been diagnosed with cancer, but just in light of the toxic overload that we have today, that's something that could stimulate the liver to help secrete all of the toxins? Is that something that is good for people that don't have cancer?
I believe so. Now, I have to put in a disclaimer when I say something like that, since we live in a litigious world, so I'll say that I'm not telling any of your audience, I'm not advising them to do it. They need to get instruction on how to do it properly. But having said that, yes, I do think that they're beneficial for anybody, and I think most people find they feel better with them, so they tend to sell themselves. None of our patients coming in for the first time ever believe this, but I tell them it's going to be your favorite part of the program, and they come back and say, you're absolutely right. I never miss the coffee enemas because they made me feel so much better.
What is it about the coffee in the enemas? that helps to detoxify the body?
Interestingly enough, when you drink coffee, it tends to suppress the liver. When you take coffee as an enema rectally, the caffeine stimulates a bunch of nerves in the lower colon called the sacral parasympathetic nerves. When they are turned on by caffeine, they feed back to the liver through a reflex arc, and within seconds cause the liver to release all its toxins. Nothing helps the liver clean out faster, more efficiently, more effectively than coffee enemas. And for cancer patients, when you're breaking down a tumor quickly with the enzyme, you get all this tumor debris that can be deadly and life-threatening. It gets the liver to work better, so they process these tumor wastes very effectively. And then you just poop them out with the enemas. So interestingly enough, when you drink coffee, it's really toxic to a cancer patient. When you take it rectally, it opens up the liver, so the liver dumps in the small intestine. You get rid of all these dead tumor wastes very effectively. I have patients that when they're breaking down tumor, you get an autoimmune reaction to the tumor, and they'll get fevers of 103, 104. Do an enema, and literally within 20 minutes after the enema, their fever goes down to normal. We see this routinely. And indeed, conventional oncologists know today, in 2014, that nothing is more toxic to the human body than dead cancer. In fact, chemotherapy, though it doesn't work for most cancers, does work for some, like Hodgkin's and certain leukemias. And in a Hodgkin's patient, if you break a tumor down too fast with chemo, you'll kill the patient from the dead tumor. And they call it tumor lysis syndrome. It's recognized in the textbooks. All my textbooks, conventional textbooks, talk about it. Well, Kelly recognized that back in 1963 when he was trying to get over his own cancer. And he started going into the literature, as he always did. He was a great scholar. He would go into the literature, trying to find some technique that would help his liver and kidney work better. The liver and the kidney are the body's main detoxification organs. That's for environmental chemicals, our own metabolic waste. The dead cancer are processed and neutralized and prepared for excretion. And he opens up the Merck manual, and lo and behold, they're coffee enemas. You know, the interesting thing, or the sad thing, is the ironic thing, Kelly was brutalized in the media for his use of coffee enemas. We get attacked about it today, too. But they come right out of the conventional medical literature. He didn't learn about it from alien space beings being projected into his brain through some mystic psychic experience. He didn't learn about it through some alternative throwaway journal, local health story. He learned about it from the conventional medical textbooks. The Merck manual is a compendium of conventional therapies, and they were in the Merck manual. Coffee enemas were in the Merck manual right up until the 1970s.
So Dr. Isaacs and Dr. Gonzalez both just shared with us about the way that coffee enemas help us to detoxify the liver. While we're talking about coffee enemas, let's listen to what Suzanne Summers had to say about the time period when she was interviewing several of Dr. Gonzalez's patients as she was preparing to write her best-selling book, Knockout.
When I wrote Knockout, I interviewed 17 of his patients. I said, I'd just like to talk to stage 4s. And I remember there was these two older women. When I interviewed them, I thought they were older, but they're sort of close to what my age is now. Funny how time flies. And they were both in their 70s, and one had stage 4 breast, one had stage 4 ovarian, only been treated by Nick. One had been had stage 4 ovarian for 17 years, ovarian. The other stage 4 breast at that time for 12 years. I haven't asked Nick recently, but as of last year, they were both still alive and thriving. And I played devil's advocate. I said, really? You're going to do coffee enemas every day? And they started joking. The older one said, yeah, I particularly like French roast. She said, gets me kind of all juiced up. I said, well, okay, whatever. But it makes sense that if you keep cleaning out the liver, and a coffee enema goes back to Egyptian, early Egyptian, Cleopatra era, cleaning out the liver of toxins in a time in the world where our livers are groaning from intoxication. It almost, you wonder how anybody can be alive without doing regular liver cleanse.
Well, that's some great information from Suzanne Summers, one of America's most beloved personalities. What about water? What effect does water have on our body, and does it help us to detoxify?
The pH of your blood is what matters, and pH of urine is great from an assessment perspective to understand what's going on from a toxin burden from some other things. But the pH of the blood is where we actually see the blood's ability to carry out toxins. If we can keep their blood pH at a 7.45, which is the threshold of blood, then we're going to have far more dissolved oxygen in that blood. When we have more oxygen, we carry out more toxins. For instance, patients that are suffering from significant pathology like cancer, if we can keep their blood pH at a 7.45 and have more oxygen in the blood, their energy levels are going to increase, their metabolic rate's going to increase, they're going to carry out more toxins.
You got to drink the right kind of water. And again, steeped in science. There's no hocus pocus here. People say, well, yeah, Bob, I know. I need water. I need to hydrate. I hear that all the time. That's good. That's good. Okay, but where's the pill? They don't get it because, again, as I said previously, it's too simple for them. Water's too simple. The right diet's too simple. I need something with drugs in it. You know, I need a pill, something that can actually knock this cancer out. And I'm saying, no, no, no. You're missing this. Each 12-ounce glass of this water hydrates the body better than anything else you can put in it. It's reshaped water. It's reshaped hexagonal like your cells, so it goes right in. It's structured, microstructured water. Each glass has more antioxidant capacity than all the organic fruits and vegetables you could possibly eat in one day. Plus, it's the fastest way to bring an acidic body back to alkalinity that we know of today. So it is steeped in science. We have seen reversals of end-stage cancer patients with pancreatic cancer, lung cancer, liver cancer, all the mostly fatal ones, sent home to die with less than 90 days. These people are well today. What did they do? They changed their water. That's all they did. Of course, I recommend you do more than that. You've got to change your food. You've got to change your water. You've got to detoxify the body. We have a new detoxification procedure, which is whole body detox. It's called PIOH. That's the acronym PIOH. I write about it in the new edition of my book. It's that important. Precision Intestinal Oxidative Hydrotoning. It starts looking like colonic hydrotherapy, but way different. You know, there's 100 ways to do colonic hydrotherapy. One is shutting a person up with a garden hose in a room, and that one's not very pretty. You know, but this starts looking like colonic hydrotherapy, but it's done with specialized equipment and perfected water. They take water and put it through a 6-stage filtration process to perfect the water, and it's really the secret. And then they utilize the water with ozone. So you've got H2O, the water, you've got ozone, O3, combining within the colon to start with to create what we call polyatomic oxygen. So it could morph into O17 or O22 or something like that. But the thrust of this is that it permeates not only the large intestine and the colon, but also the oxygen permeates all the cells and goes into the body. Oxygen's good for a cancer patient and for all of us.
So water is of vital importance in the detoxification puzzle. But what about emotions? Can negative emotions, feelings of despair, negative thoughts be detrimental to your health? What about the feeling of despair? Does that have any kind of
The Bible says that, you know, the power of the tongue, or that the power of life and death is in the tongue.
In the tongue.
So if you pronounce somebody dead, they see the doctor as an authority. And so they buy it, I'm dead, no matter what. And the truth is that not only doctors are not gods, we don't know, but nobody in this room knows if we're going to be alive tomorrow.
True.
And by the same token, you can never say that a cancer patient is going to die. We've had patients that were told that they were going to die in 3 months, and 20 years later, you met one, Burga Rati today, 27 years later, she's still alive. She's not cured, but she's alive, enjoying life.
Yeah.
And so the first thing that I impress on a patient is that victory over cancer is a decision, not a happening. You don't have to be victorious for the tumor to go away. There are patients that have surgery, chemo, and then the tumor goes away and they can't sleep. Why? Because they don't know when it's coming back. So they're tumor-free, but not free of cancer. And there are other patients that say, you know, cancer is the best thing that ever happened to me. Before I had cancer, I took everything for granted, and now I see life is beautiful. And it's because of this cancer that I can see that, and cancer is the best thing that ever happened to me. So that person is riddled with cancer and is victorious over cancer.
I know many people that fit that description.
And so it's very important, if you have victory over cancer in your mind, everything follows. If you decide that you're going to die, it's very difficult to bring you back. Viktor Frankl could determine who was going to die within 24 hours in the concentration camp. And it was when they smoked their cigarettes. And you say, well, cigarette cannot cause cancer in 24 hours. No, cigarettes were their hope, and they traded everything with cigarettes. So when they had no more hope, they started smoking their cigarettes, like you burning your money.
Ah.
And they would die within 24 hours. So the power of hope is incredible. That's why we're the oasis of hope. And we've been criticized enormously for selling false hope. And my question is, well, if false hope is telling, you are going to live, what is true hope? You're dead?
Right.
No, there's no false or true hope. There's false, there's hope, or no hope.
Well, it reminds me, Dr. Contreras, of a quote from Charlotte Gerson, who was accused of spreading false hope, much like yourself, and she accused them of spreading false despair.
Yeah. Well, really, true despair.
True despair.
You're dead.
Yes.
You have to start chemotherapy now and you'll live 6 more months with no hair, vomiting.
A negative thought can kill you faster than a bad germ. So one of the main things to detoxify is here.
The mind.
The mind. The emotions, the conflicts, the traumas, going back to what we said earlier.
Sure.
So detoxing those psychological, emotional, biological conflicts and trauma is key.
What a telling quote. A negative thought can kill you faster than a bad germ. We know that when you're stressed, that you secrete adrenaline and cortisol, which then compromise the immune system. So that makes sense to me. What about epigenetics? What exactly does epigenetics mean? And what about the placebo effect? You've heard the stories of people that took a sugar pill and got better. Listen up.
You're always hearing about genes and genomes now, and we know about genetics and epigenetics. Sadly, Angelina Jolie was dealt a bad hand by doctors who simply don't know but think they know. Why would a woman with 2 perfectly good breasts who carries a BRCA1 defective gene have them prophylactically removed because someone said her chances of cancer went up? The odds are, if you live right, and this is called the epigenetics, if you live right, the cancer will never ever manifest itself in your body. If the genetics is the computer, the epigenetics is the software that drives it and runs it. We now have epigenetic products. We recommend now a supplement that is the only one that is proven to be epigenetic in nature. In other words, it can turn off the bad genes and turn on the good genes. We're pretty excited about that, although we know that there's a lot of foods out there that do the same thing right now. So we've already got that answer. It's already there. We just need to pay more attention to it and actually utilize these types of things. We'll have much less cancer or any disease.
So when you mention epigenetics, you are talking about things, lifestyle choices, things that folks can do that would stop their potential genetic predisposition from manifesting.
Yes, what you can do, what you can stop doing, things that you can take, foods that you can eat, supplements that you can take that change what people think is that predestination that a gene or a defective gene gives you.
Well, we all have strengths and weaknesses, and in homeopathy we talk about miasms, inherited predispositions. So it's not like we ignore genetics completely, but the reality is what makes them manifest is environment. This gets into something called epigenetics. One of my favorite interviews, a few times I've met him and befriended him, the cellular biologist Bruce Lipton opened my eyes to this whole field of epigenetics, that the environment impacts on genetic expression, and that your very belief about life and everything impacts on genetic expression. So you can literally change your genes by what you believe. And of course, if you talk to any doctors that work with cancer holistically, they'll recognize that they can do everything to remove toxins and replenish the soil of the body, give the minerals and things. But if the patient doesn't believe he or she will get well, there's not a lot you can do ultimately in that regard.
I will tell you this. I think that in modern medicine, this demonization of placebo effect is the most ridiculous thing. We should be harnessing it. We should be harnessing it. Exactly. I can't tell you how many times I've used placebo on purpose. When I was in general surgery, I was part of our surgical rotations. You have to do trauma surgery, you have to do general surgery, different types of surgery. And when we did trauma at Brooke Army Medical Center, a large trauma center, as well as at Baylor in Houston.
BAMC, Brooke Army and Baylor.
Yeah, so I spent a lot of time in both those hospitals. But we'd have a lot of drug addicts that would come through gunshot wounds, knifings, drug deal gone bad, whatever. And while they're in recovery after the surgery, and they may be in the hospital for a month, 2 months, 3 months, these people are going through withdrawals, big time withdrawals, from alcohol, from drugs, whatever. And you, as an intern, as a resident, you make rounds with the senior residents and everything. And as a intern, you make rounds before everybody else does at 5:30 in the morning. And as a first-year resident, you usually go over with the intern to see what all's going on. And I got the reputation among the people that were in the hospital that I would take care of their issue if they had an issue. Well, the reason I got this reputation, you got a guy that's been hooked on drugs for more than half his life. He's in the hospital. He's going through withdrawal. I'm having pain, chest pain. I get, doc, you got to do something for me. And I'd, look, okay, listen, I can get kicked out of my residency program if I do this, all right? And you talk to the nurse, and the nurse already knows what's going on. The nurse, she argues, no, Dr. Patel, we can't do this. We have to. He really needs this. And it's only one time, right? You only ask for this one. Yeah, doc, just one time. And you'd give him this hit. Say, it's just really, really some strong stuff. Okay, this isn't even. This is like way more. What is it? Oh, it's like Sufenta. What? You're gonna give me Sufenta? Oh man, that's so good. And then you give him this thing, and they go, oh, I'm feeling better. And you've just given them saline, but the power of the belief, they believed there was something, because it's a whole orchestrated, it was like a soap opera we had going on there. Like 5 or 6 people were all involved with this. The person felt like you gave them something. They were willing to not perform for you because you did something for them. They thought that you just gave them something that really took care of their addiction, and it was all in the mind. It was just saline. But that's worked more than half the time it worked. Now, you're telling me that we should say, oh, just write that off? Why? Because you know what? You can give a person a drug and you wouldn't get that kind of effect. We should harness that power. So if we can actually elicit that type of response in an individual, where we can get a benefit in that individual from just the power of belief without changing their physiology, it's our ethical and fiduciary responsibility as healers, as doctors, to harness that power and get that result. Because if we can do so with the least harm, that's the first part of being a doctor, right? Do no harm. Do no harm. And if you give somebody narcotics, you are affecting them in a negative way. You're affecting their liver. There's harm that's being done. So if we can get the same result without giving them a narcotic, why shouldn't we? And why is that poo-pooed? Why is that ridiculed that, oh, you got this result from a placebo? You should get a Nobel Prize if you can elicit a response from a placebo, as far as I'm concerned, at least.
Wow, yeah, that makes total sense. I agree. Because you've done no harm.
Exactly.
And you've potentially healed the patient.
Just from the power of belief.
Wow, the power of the
mind. The power to heal is yours. That's how we do our radio show every Monday, right? Mm-hmm. The power to heal is yours. And this is a perfect example of the power of healing is that individuals. It's their right.
I'd have to agree with Dr. Buttar. The power to heal is yours. Now, while I was out in California earlier this year, I was able to sit down and talk to Burton Goldberg about the lymphatic system.
One of the systems that is the garbage removal system of our body is a lymph system. And very few cancer physicians pay attention to the lymph system. It is the basis of lymphocytes. These are the good guys. And it also is the garbage removal system of the body. And I use a device myself. I have one that I use on myself called the light beam generator. But there's a few of them that fractionalize the molecules.
So what we have our patients do is we have them do things like rebounding. Rebounding is one of the best exercises against cancer and every other disease because it moves your lymph system better than anything else, and moving your lymph is the most important thing against cancer and disease.
That's fascinating, Dr. Wolf. Tell me why. Tell us why. Why is rebounding so important?
Well, remember what I said. I always want you to question people. I want all my patients. I say, you question me and you question everyone else. If they're not speaking logic, if 1 and 1 don't make 2, or if you go there and you go, I'm confused, or if you feel fear from something I said, chances are I'm lying or I don't know I'm lying. Okay, so rebounding. Think about it. When your children were young and they couldn't walk and they were like little babies and they were crying, what did you do for them, Ty? Do you remember? You bounced them on your knee. Or you rocked them on your shoulder. Why'd you do that? Because you aren't totally brainwashed. You still have some instinct left. So you rock the baby, right? And you rock the baby because the only way that the lymph system can move is by up and down motion. And your lymph system, okay, you've got 8 pints of blood, but you've got 12 quarts of lymph. Don't you forget that. And when you find that you're getting all puffy and swollen, that's your lymph system and you're in big trouble. So you know when people, they swell up like a puffball? Well, that's because they're retaining water because they're so bloody toxic and they've been backing up waste for years. So when you start cleansing out the colon and then you rebound, you're moving that stuff. If you move the circulation, it's like if the water doesn't move, you better not drink it because it's going to kill you because it has to circulate. So rebounding also exercises every cell individually, toning it.
Excellent information from Dr. Wolf. Rebounding stimulates the lymphatic system better than any other exercise. But I know you're asking a question. What is the lymphatic system? Let's listen to Dr. Urban Sani explain the lymphatic system, and we'll learn exactly why it's so important in our overall health. Talk about the lymphatic system. What is the lymphatic system?
Yeah, so the lymphatic system is something that I think people aren't as aware of as their lungs and their heart. The lymphatic system is basically, to some degree, an overflow valve for the body. So what happens is, we all know our heart pumps blood out to our distal extremities. They go from arteries, and the arteries go to capillaries, and then the capillaries. So most of the blood that pumps through your body, it's constantly pumping through your body, goes from arteries to capillaries and passes back into your heart through veins and goes in this circuit through your heart and your lungs. There is some bleed off, okay, and that's what we call interstitial pressure in tissues. And there's some bleed off where fluid, and a lot of it has to do with osmotic forces. I don't know if you remember, people remember osmosis and basically tissue pressure gradients. And some of this fluid will bleed off into that interstitial pressure, because the pressure inside the vessels is greater than the pressure outside the vessels, and there's some bleed off, some loss of fluid. Well, that fluid doesn't jump back into your veins. It has to go somewhere. That's why some people get edema. They'll get swelling in their ankles and swelling in different parts of their bodies. Well, where does that fluid go? Does it just disappear? It goes into your lymph system. So your lymph system is a system of vessels. There's different components to it, but your lymph system is a system of, it's kind of like vessels. They don't have muscular walls like big arteries, but the lymph system grabs this fluid and then returns it back into the system, ultimately back into the venous system through a large duct in your chest called your thoracic duct. But this extra fluid that sort of bleeds out through these capillaries will then feed back into that system. It also passes through other parts of your body, including your spleen, okay, and that's also sort of considered part of your lymphatic system, your thymus, your tonsils and your adenoids, what a lot of people will have removed as a child. There's lymph tissue, where there's lymphocytes, and those lymphocytes recognize pathogens, viruses, bacteria, or things that are considered non-self, and your body builds immunity through those lymphocytes, which is what's affected when someone has an immune deficiency disorder. Whether you believe in HIV virus or not, there's certainly immune deficiency disorders, and T4 cells and helper cells, different classes of cells are affected when the immune system falters, and those are the little soldiers that are facing these pathogens, these bacteria, these antigens, toxins even, as they pass through the lymphatic system, and sort of as a kind of like your oil filter, I guess. They're filtering out some of the nasty stuff. So the reason jumping on a trampoline is useful is because your lymphatic system, unlike other parts like your muscles in your heart or your skeletal muscle, it doesn't have its own muscle. It doesn't have a muscle wrapped around it. Like arteries have muscle around them. It's called the tunica media. It's what helps vascular changes. You can actually change the pressure by those muscles clamping down or letting go. Well, the lymphatic system doesn't have that ability, and so it depends on the skeletal muscles for that return. So by compressing your thighs, by just simply walking, you're actually pushing lymph through your body. It's sort of passively pushed through by the other muscles in your body. And so by hopping on a trampoline, you're basically forcing those muscles to contract, and you're helping that drainage. Instead of having it collect in your ankles, like you see people with swollen ankles, you're helping some of that return. And that's why when people start having problems with blood pressure and their heart, they sometimes will get swollen ankles, because that big pressure differential is pushing all that fluid out into their interstitial tissues, and their lymph system can't keep up, especially if they're sedentary. If they're sitting around, they're sick, their heart, they have congestive heart failure, and their heart has poor return, so they get dizzy quickly. They're not going to be able to get up and walk around to help push that lymph back into their venous system. And so a healthy person can just constantly contract their muscles and keep that going. It also prevents you from, that constant activity is what also helps you from getting deep vein thromboses. I don't know if you remember, I can't remember who he was. There was a reporter who was embedded in either Afghanistan or Iraq. He's kind of curled up in a ball and got dehydrated. He got DBTs because of inactivity, okay, because he wasn't walking around, and that clot was thrown to his heart, and he died. He was 44 years old. I know he's in his early 40s when it happened. Very unusual, but again, inactivity is bad for you. And so, and the converse is true, I think. Activity is good for you. And that's why that specific form of exercise helps helps assist the lymphatic system in returning that fluid back to the venous system.
What a fantastic explanation of the lymphatic system from Dr. Sani. While I was asking him questions, I wanted to get his input on the effect that heat has on cancer cells, specifically far infrared saunas. And I also got the input of Dr. Tony Jimenez, who leads the Hope for Cancer Clinic in Tijuana, Mexico, on the same issue. Dr. Sani, talk about far infrared saunas. I know that you're a big proponent of far infrareds. Talk about the effect that this can have on cancer.
So far infrared saunas, the way they work is relatively simple. They exploit or take advantage of a portion of the electromagnetic spectrum that basically increases the temperature of the body, creates hypothermia, without exposing the body to some of the negative portion of the spectrum, which we know is the ultraviolet spectrum. Go out in the sun too much, you can get skin cancer, especially if you don't wear sunscreen and you're light complected. So far infrared sauna takes a part of that spectrum that creates heat, but not necessarily damage in the way that being out in the sun does. I think the Indians were probably, the American Indians and people who were doing these, more ritualistic heat treatments on themselves long before far infrared saunas were around. Kind of, maybe they didn't understand the science behind it, but they knew it was good for you. But basically, what it does is it raises your body temperature, and then your body has to release that heat. The way we release our heat is by sweating, and that sweating the sweat helps carry the heat away from the body. So by stimulating that mechanism, people don't realize this, but you excrete just as much urea, okay, through your skin, right? Maybe more. I'd have to go back and look up the numbers, but a significant amount of toxins are excreted through your skin as they are in your urine or your stool, and in some cases probably specific toxins even more. And so by exposing yourself to a reasonable time frame and a reasonable level, a safe level of heat, you can just basically stimulate your body to sort of accelerate that excretion of toxins, and you can make that happen faster. The other reason a far infrared sauna is so useful is that normal cells are able to withstand heat because of their normal anatomy compared to the abnormal anatomy of, say, a cancer cell, especially in relation to its vascular supply. And so a cancer cell doesn't do well in a hyperthermic situation. This has been shown in mainstream science to be the case. And so by exposing your body to that heat, you're selectively killing or eradicating those less viable cells, those cancer cells, without hurting your normal cells. And so a far infrared sauna is useful because it can help you sweat, excrete toxins, and in theory eliminate cancer cells which can't survive the heat as well as the normal cells.
Yes. I have a question for you on hyperthermia.
Okay.
Hyperthermia means that you superheat the body, right?
Exactly.
Why is that effective at treating cancer?
Cancer cells are heat sensitive. Normal human cells are heat resistant. That's why when you and I get a flu or an infection, our temperature increases as a mechanism to get rid of that pathogen, whether it's a virus or bacteria. But the healthy cells are not being killed because normal cells are heat resistant. Cancer cells are very fragile to temperature. So I don't believe that we need to get the body temperature up to 106, 107 degrees Fahrenheit. That's just too tough, and it's causing red blood cell destruction. Oftentimes you have to give the patient blood transfusion. We get the oral body temperature up to about 101.4 degrees Fahrenheit, knowing that at the core it's probably 1.5 to 2 degrees higher. So we're getting to about 103 degrees Fahrenheit, which is a very good temperature to cause that cancer-killing effect of these cells that are heat sensitive.
And so the heat damages them,
yes,
but doesn't hurt the normal cells.
Correct.
That are heat resistant.
Exactly.
So cancer cells don't survive heat as well as normal cells. Sounds like this should be part of everyone's detoxification regimen. I've saved the best for last. Dr. Darrell Wolfe, the Doc of Detox, gives you specifics about the order by which you can cleanse your entire body, a full body detox. You've written a book called Spoiled Rotten, and in that book you go through the order by which you should cleanse the organs.
Yes.
So go through that in 3 or 4 minutes. Go through the order that someone would need to go through in order to detoxify their whole body, organ by organ.
Okay. So when people usually ask me this question, they go, well, what should I cleanse first? And I say, well, what sticks out the most?
Tommy.
So that would be the first thing, right?
Right.
So that would be your large intestine. So the first thing you want to do is, if you clean out the large intestine, then right away you're going to reduce the toxic load on all the other organs. If you request any of the other organs to detoxify before you do the large intestine, then what you'll do is you'll start backing up into the bloodstream. Or you will even cause further stress to that organ itself or the other organs if they happen to be weak. So the large intestine would be the first place to go, right? So it's kind of like this. We always work from the bottom up, okay? So we want to do the large intestine first. And of course, then the next thing that I would do is the liver, okay? And then after the liver, then we would be looking at doing the kidneys. And by doing those 3 major organs, you're already working on your lymph system. You're already working on your skin. So you are getting, those are the 3 major ones that I would tell people to do, would be the colon, the liver, and the kidneys. And if you work on those 3, then the rest come along for the ride. Yes.
So one of the things that I've heard from many of the interviewees is coffee enemas are great for the liver detox, right? So that's one way to detox the liver. Any other suggestions on liver detoxification?
Well, if I can just say, the coffee enemas are absolutely great for the liver. And they were great for the liver for the medical system up until I think probably about 15, 20 years ago, and then they weren't great for them anymore. But they're still great. And what they do is they help to trigger the liver to get rid of that sludge that usually would not come out. Okay? And then the other thing is to do like a gallbladder flush. That's another great thing for some people.
And what natural substances might be used to flush the gall?
Well, there's different ones, but in that sometimes Epsom salts is used, sometimes it's olive oil that's used. Okay? And it's to basically make the organs contract. So the other thing too is when you go into a detox, a lot of people get scared when they feel pain in an organ. That's when you need to breathe and just relax. Because that pain that usually you would be feeling is actually your organ contracting and going into spasm. That spasm is the only way that it can get rid of it, right? Because it goes out, out, out. So that's one thing I think is really important, that when people start to detox, and when they start detoxifying the colon and they start getting gas cramps or they feel nausea, okay, that's the old waste loosening up. And sometimes when you start your detox, you might have diarrhea. And if you start to get diarrhea, if it lasts for more than a day, then you want to back off on that cleanse. But but even diarrhea for the day is not dangerous. And you may get diarrhea from a liver cleanse or a kidney cleanse, because everything's getting dumped to come out through that main portal.
Right.
So don't let that scare you. And like I said, diarrhea won't kill you. It might make you feel a little bit weak. So we don't want it to last too long.
Let's go to the kidneys real quick. So we talked about the liver, the gall. We know there's many good colon flushes. You've talked about the Master Cleanse Tea. Let's go to kidneys. How do you detoxify the kidneys?
Well, Hulda Clark has a kidney cleanse, a herbal kidney cleanse that I really like. Okay. It takes about 3 weeks to do it, because the kidneys, they don't react as fast, okay, in cleansing. They take more work and effort. Just like when somebody says, I've got kidney disease, unless they're really going to pull their socks up, it's already too late. So, your kidneys have to take a real beating before they get into that kind of trouble. So, but doing a kidney cleanse even once a year is a really wonderful thing, because your kidneys do so much work, and they're more silent, They're more silent than the liver, and they're more silent than the colon is, because they just are. But, a lot of times low back pain, pelvic pain, pelvic girdle pain will actually, hip pain, that is usually can be a sign of that the kidneys are overburdened, okay?
And what might be a substance that someone could use to get rid of the toxins in the kidneys?
Well, you know, even just doing 6 to 7 days of just watermelon.
Watermelon
will even help. You know, but there's many different herbal tinctures that you can go and find. There's a lot of really good kidney cleanses.
Yeah, that's a common one that I read about is watermelon for the kidneys.
Yeah, I try to do that every year.
So there is a specific order to detoxify your body, and Dr. Wolf, the doc of detox, just shared it with us in a very understandable manner. Let's listen to what he has to say as we conclude this episode.
Do you notice how every group has an icon, like a figure that they look up to, right? For the medical system, what's their icon? Their icon is Hippocrates. Hippocrates was the father of medicine. And if you don't mind, I'd like to read this because I don't want to get it wrong. So, their leader, who they look up to, because they took the Hippocratic Oath, right? Okay? This is what they look up to. Let food be thy medicine, and medicine be thy food. I don't know. They don't talk about diet. I mean, that's the root of all life. So right there, they've failed greatly. Make a habit of 2 things to help, or at least do no harm. Meanwhile, we've got a war on cancer. You can't go to war with anything, Ty. You want to go to war with me? What happens?
We both die.
That's right. Thank you. Next thing, natural forces within us are the true healers of disease. So, where have they forgotten? They have forgotten, I haven't forgotten, you haven't forgotten. So we must go within and we must understand something. That nobody's going to save your butt, Ty. When you got that body and you came down here on that planet, you made a promise to somewhere, somehow, that you were going to respect and love your body and you were going to make the decisions. Every decision, okay, has a consequence, and it can be either good or bad. Now, do you let somebody else look after your finances, Ty? Well, why would you let someone else look after your body? Okay, one last thing that Hippocrates stated. Whenever a doctor cannot do good, he must be kept from doing harm. What happened to the Hippocratic Oath? I think the only thing that's left is called the hypocrite.
Wow, what an amazing episode, folks. Tonight we learned specifics on how you can get rid of the trash from your body, how you can detoxify. Now, there's toxicities in a lot of things. Did you know that a lot of medicines have toxicities in them? Have you ever looked at commercials on TV and seen the list of side effects? I mean, sometimes it's more than half the commercial listing the side effects of these drugs. Now, that's an example to me of people that are looking in the wrong place for answers. Drugs don't cure. They mitigate symptoms, but they don't cure. I mean, if you have a headache, is it because you have a lack of Advil in your system? I don't think so. You've got other things that are going on in your body. Now, this reminds me of a time about 3 or 4 years ago that I was in West Virginia with a friend of mine who's actually a medical doctor, but he's also a medicine man for an Indian tribe. And he took me through the forest. He asked me to list anything that I could see, whether it be trees or bark or herbs or weeds, anything that was growing that wasn't medicinal. And I started pointing out things, and he said, no, you're wrong. That does have this medicinal effect or that medicinal effect. And in the end, I learned that everything that was growing was medicine. It was a whole pharmacy right there in the middle of nature. It was nature's pharmacy. And that's what we're going to learn about tomorrow, nature's pharmacy. The way that everything that we need is growing in nature. All the medicines that we need are natural medicines, and they're growing out there just for you. We're going to teach you about that tomorrow. And by the way, it's not surprising that all of nature is a pharmacy in light of the fact that between 70 and 80% of every prescription drug has its basis where? In plants and herbs. Makes sense to me. I think it'll make sense to you too tomorrow night, so please tune in. In the meantime, have a great evening and God bless you.
I was diagnosed with prostate cancer 10 years ago, and I had the fear of death put into me by the urologist. And he had a bedside manner of a Neanderthal as far as I was concerned. And it prompted me to study natural medicine. When the doctor tells you you've got cancer, And he says it just like that. You know, there's two things you know about cancer. One is you're going to die, and you're going to die soon. That's the average person's view of having somebody say that you've got cancer. And it's the most irresponsible thing that a doctor can do, particularly with prostate cancer, because you're not going to die tomorrow, or the next day, or the next month, or perhaps even the next year or two. But if you have conventional treatment, the potential for you living with impotence, incontinence, and the cancer coming back more vigorously than it was there in the first place are pretty damn good. Look at the statistics. It's not me that's saying this. These are statistics that can be studied. So when you figure that out and you look at them and you go, wow, I'm enjoying my life. I better look at something else. I better figure out a better way. And that's when you start studying. And you'll be amazed at how conventional medicine will fight you every bit of the way. By all intents and purposes, I mean, I've been here 10 years now, supposedly with cancer, but I've been cancer-free probably 5 or 6 years. It's a privilege. I honestly believe that me getting prostate cancer was a blessing. And I don't necessarily mean that in a religious world, but if it works, then it was a religious blessing, if you like. But it was a calling for me to do something different. And later on, because of my ability to make documentaries, it was a calling to do that. We are over-treated, we're over-diagnosed, we're over-tested. What we're not told is how to live our lives to avoid some of these problems. And if we have the problems, how to live our lives to live through the problems and get better. How to manage the body. You know, how to eat, you know, how to talk, how to think, how to get rid of stress. You know, how to resolve emotional traumas in our life so they're not a taxation on our immune system. Nobody's teaching that. When you go to the urologist, he hasn't got a clue about those things. All he knows is, I'm a surgeon, I cut, I take your prostate out. That doesn't resolve anything. All it takes out is the prostate and the tumor. And then if the cancer comes back, they say, well, obviously we didn't get it all. No. The problem is that the cause is still there. And the cause will create cancer somewhere else. If there's no prostate to create it in, it'll create it somewhere else. I've done a lot in my life outside of this. You know, I've made lots of documentary films. I've done a lot of television shows. I was a stuntman for 10 years in movies like Batman and Robin and Apollo 13. I mean, I've done a lot. I'm just grateful that at this stage of my life I have a purpose, and the purpose appears to be coming to me to do this. I'm pretty grateful for that. A lot of people don't have any purpose in their life. I'm grateful for having that purpose. You see the smile on their face, or I've had phone calls from people saying, thank you, you've saved my life. I've actually had phone calls from people say that. That's pretty damn powerful stuff on any plane, you know? I mean, I talk to a lot of doctors. Yeah. I've changed the minds of a lot of doctors that had no idea of the research that is out there that's been done that they never get taught in medical school. I lost my father to the treatment for prostate cancer. Not the disease, the treatment. But what was more of an emotional issue when I started to study prostate cancer when I had it and found out that he'd been killed by the treatment, not the disease. He could have had 10, 15 more years on his life. If you realize that the standard of care for his day was a drug that killed him rather than the understanding that prostate cancer can be lived with and managed, I was pretty pissed off. Because the doctors of the day had no indication, no inclination about looking beyond what they were told to do, which was, you got this disease, you get this drug. You got to understand the thing, the drug of that day that they gave my father was a drug called flutamide. Flutamide is an androgen deprivation drug. It kills testosterone. If you don't have testosterone in your body, your bones shrink and will break, and your muscles collapse. Now, what's one of the biggest muscles in your body? Your heart. Okay? Without testosterone, your heart will stop, you will die. You don't die of prostate cancer, you die from the results of the drug they're giving you that kills testosterone in your body, prevents your body from naturally making the testosterone that it needs to support your own life. But he missed out on his life. That's the issue. And they call them side effects. They're not side effects, they're direct effects. My father dying was a direct effect of him taking that drug, not some sort of willy-nilly side effect. If he had never taken that drug, he would not have died of that heart attack. And on the certificate, on his death certificate, it says myocardial infarction, heart attack. It doesn't say death from the drug of prostate cancer.
It should, shouldn't it?
Of course it should. It's incredibly dishonest.
You feel that it's dishonest?
I certainly do. Because instead of it being a statistic of dying of flutamide, it just says myocardial infarction. What the hell do they learn from that? Nothing. He died from the drug of taking prostate cancer that he was being made to take by his doctor, because that was the standard of care in that day.
Your dad wasn't ready to go, was it?
One assumes not.
Right.
Well, who of us is? Right. I mean, because we're not getting the truth from conventional medicine. We're just not. So any organization, whether it calls itself The Truth About Cancer, which is a great title, or whether it's my small organization, which is Healing Arts Education Foundation, we're all in the same game to help people understand what it is that's making this medical world tick and how to really get around the pitfalls of particularly cancer treatment.
So this information is so valuable. I mean, it literally could save your life or the life of someone that you love. And there's no doubt about that. And so I want you to have this information. I really want you to choose to own this today, because this information is going to be available for about 24 hours and then it's gone and the next episode is going to air. So, by choosing to own this today, what you do is you not only support us and our mission to eradicate cancer once and for all, but you're going to provide your friends, your family, your loved one, someone that you care about with knowledge, with information that's going to be valuable to save their life potentially, or one of their friends' lives. If you choose to own this today, you're not only going to receive your DVD set, but you're also going to receive a free digital copy that you can share with a friend or a family, someone that you love. And you're really going to be getting information from some of the smartest people on the planet. Some of these medical doctors that we've interviewed are just incredible. And the knowledge that they've shared with us is literally life-saving. So I urge you to own one of these copies today.